presented here would be the answers from your last assignment regarding the toxicological syndrome or toxidromes of each classification of drugs, so that I've shared with you last time. So if you want, you can take a screenshot of this, or if you still have a copy of your assignment, you may use that as a reviewer for the midterm exam, since there are some questions will be coming from the said toxidromes. So now let's start with module number 2, toxicological testing and mechanisms. So for the intended learning outcomes of this module, number 1, we will discuss the different toxicity tests that are performed. As example, if we want to evaluate or examine the potential adverse effects of a drug. The next would be to explain and then describe the different toxicity endpoints. And then next is to determine what are the options if we want to pursue a non-animal toxicity test method, since most of the time animal testing is done in order to identify the toxicity of a drug or a substance. But there are also non-animal toxicity test methods that can be performed. And the next would be to learn the mechanism of toxicity of the following drugs, classification of drugs, including cardiovascular, respiratory. We also have anti-infectives, and then the analgesic agents. And then what are their appropriate treatment, and then prevention. Say toxicity is observed from these drugs. In fact, you have answered your case study last time. And then one of the items there would be for you to identify the treatment approach for each type of toxicity. So let us start with toxicity testing before we discuss the mechanisms of toxicity of those drugs. So first of all, what do we mean by toxicology study? By the way, don't worry, again, a copy of the presentation will be shared to you afterwards. So toxicology studies are used to characterize the toxicity profile of a drug by identifying its impact on organ structure or functionality. So in toxicology study, we will assess the drug or a substance according to the following: severity, reversibility of toxicity, as well as the dose ranges. So in toxicological study, we wanted to determine the degree, first of all, the degree or the extent of the toxicity or the severity. Will the drug cause a mild, a moderate, or a severe toxicity? So up to what extent or up to what degree of toxicity will the product or will the drug substance produce? And then another would be the dose, the dosing range. Will the drug elicit a toxic effect up to 1,000 milligram dose, 500, 2,000 milligram per kilogram? So we're going also to determine the dose range or the dosing at which the drug substance will produce a toxic effect. Then we will also determine what would be the mechanism. So example, pag mga sympathomimetic agents, their mechanism of toxicity is also related to their therapeutic action. Even anticholinergic agents or cholinergic agents, so their toxicities are usually extension of their therapeutic effect or therapeutic action, just like the opioids. So what would be the mechanism of toxicity? And then lastly, the route of exposure. Will the drug substance elicit a toxic effect when administered orally or when administered topically? So in fact, one best example of that would be some of our antifungal agents. So we all know, class, na hindi naman lahat ng antifungal drugs ay administered orally. Kasi some of them are administered topically. So example, yung mga Canesten natin, yung mga Nizoral, di ba, yung mga Miconazole na yan, Clotrimazole, Nystatin. Those are examples of antifungals that can only be administered topically but not systemically. For the reason that, according to their study, administration of those antifungal agents systemically can cause toxicity. That's why in toxicology study, we also want to know what would be, at what or at which route of exposure can the drug be administered without any significant adverse effect. That's why we have now to determine the route of exposure. So this picture shows an example of the different phases of clinical trials. So as you can see, we have this preclinical development where preclinical safety and toxicity testing is done. So again, at this stage, a preclinical safety and toxicity testing is done. Because why do we need to perform a preclinical safety and toxicity testing? Because first of all, we want to know what are the potential toxicities that the drug can produce. Para alam natin during the clinical trial, the phase 1 up to phase 4, alam natin which drug or which adverse effects should be monitored. So by performing preclinical safety and toxicity testing in animals, to be specific, we are trying to estimate what are the potential adverse effects that these drugs can produce when they are now going to be administered in human subject. So at least we know which toxicities to monitor. So that's why we perform preclinical safety and toxicity testing in animals. Because this is what you have to remember. No chemical, no drug, no substance is 100% safe. All of them at some point will produce potential toxicities or adverse effects. So anong basis natin? Why are we still pursuing clinical trial? Kasi we have to estimate or we have to weigh if the benefit will outweigh the risk. That is why we perform such testing, because we want to know, will the benefit outweigh the risk? So kung benefit naman is greater than the risk, then we continue. If not, then we have to reevaluate our drug before subjecting it to clinical trial. So this is a diagram showing the phases of clinical trial wherein preclinical safety and toxicity testing is done. Now, we have the following safety tests performed during preclinical safety and toxicity testing. So number 1, we have the acute toxicity. So first on our list, so usually for short-term exposure, diba, if you still remember, up to 14 days only. And then we usually use animals here, 2 species. Diba, rabbits and then rodents. Ayan, so yun yung mga examples. Then subacute or subchronic, for longer, if the drug or if the substance is expected to be used for a longer period of time. So ganun din in 3 doses and 2 species. Chronic toxicity for more than 6 months. And then effect on reproductive performance. So we have the following test animals identified here. So we are trying to determine not only yung effect niya dun sa offspring, but even dun sa mating behavior ng ating test animals, reproduction, parturition during delivery, and then sa effect niya sa progeny or dun sa offspring, are there birth defects produced dun sa offspring after delivery. And then carcinogenic potential, that is usually determined if you know that the substance or drug will be administered for a long time. So we usually determine its carcinogenic potential pag alam natin na yung drug is intended to be administered for a long time. And then mutagenic potential. So in mutagenic potential, we are trying to determine the effect of the drug or a substance or a chemical to the genes or to the DNA itself. So pwede siyang in vitro or in vivo test. In fact, during our undergraduate research, we actually performed this anti-mutagenicity test. Although we did not perform Ames test, kasi yung Ames test class, gumagamit to ng bacteria. So the bacteria is Salmonella typhimurium. So i-chat ko na lang ako, I cannot write. Yan for Ames test. Kaya lang hindi na rin siya masyadong ginagamit kasi medyo outdated na rin yung procedure. Now, what we have and what we also performed during our undergraduate study when we performed this test was the micronucleus test. Micronucleus test for mutagenic potential or for anti-mutagenicity using female ICR mice. Female ICR mice. So, ang ginawa namin, class, we administered the drug, and of course, we have our positive and negative control. Tapos, ang inducer namin nun of mutation was mitomycin C. So, mitomycin C yung ginamit naming inducer. Tapos, ang ginawa namin after yung period ng treatment namin, we extracted the bone marrow of the mice, of the female ICR mice, and then we extracted the bone marrow in order to get or to harvest yung cells, yung red blood cells, and then the erythrocytes, and then yun yung sinubject for observation. So, ganun yung ginawa namin. Medyo matrabaho kasi we have to extract the bone marrow of each of the mice, and then we have 5 groups. 1 for negative control, 1 for positive, tapos 3 doses namin. So, total of 5. Ilan nga ba yun? 5 animals per group yung ginawa namin. So, we performed this one for mutagenicity kasi our study before, it was all about the anti-mutagenic potential of fish oil. So, fish oil yung ginamit naming extract. Next would be, so for the protocol that you have to follow, let's say if you want to perform toxicity testing in your future study, maybe if not now, in the future study, kung halimbawa mag-pursue kayo ng graduate school or if maging researcher kayo. So one of the references that we consult would be the OECD. So this is an internationally accepted specification for testing of chemicals. So more on ang focus nila is the protocol, the procedure if you want to perform a toxicity testing. And specifically, toxicity testing in test animals would be found in section number 4, which is the health effects. So if you want to consult mga toxicity testing procedure, that would be on section 4, health effects. Okay, next would be one of the procedure in acute toxicity testing is to determine the lethal dose 50 or the LD50. So when we say LD50 class, this is actually the dose or concentration that is expected to kill half of the test animals. So again, when we say lethal dose 50 or the LD50, this is the dose or the concentration, let's say, of your test substance or your sample that will kill approximately half of your test animal. So ginagamit siya in establishing the toxic dose of your drug or of your test sample. Now, the idea here is the lower the LD50, the more toxic the substance is. Kasi ibig sabihin, at a very small amount or at a very small concentration, the drug can already kill the half of the population or the half of the test animal. Kaya the lower the LD50, the more toxic the test or the drug substance is. So that's the idea. So for this example, can you identify what is our LD50 from the starting population that we have? So on the chat box, can you identify what is our LD50? Okay, so at which dose, what is our LD50? Again, to define LD50, the dose or the concentration that will kill half of the test animal. So that would be 300 milligram per kilogram, because our starting population is about 8, And then the LD50, again, half of it would be 4. So that would be 300 milligram per kilogram. So the lower the LD50, the more toxic the substance. So this is one of those points that we determine during acute toxicity testing for you to determine the LD50. As far as I remember, we performed this in our undergraduate research kasi wala kaming standardized na dose ng fish oil namin. Kasi hindi naman nga madalas din ginagamit yung fish oil for anti-mutagenic potential. 'Di ba ang alam naman natin pag fish oil more on cardiovascular kasi yung application, pero ang ginawa namin medyo nag-iba kami nung approach. Kaya lang wala kaming standard na dose. So we have to establish by performing toxicity testing bago pa yung pinaka testing or treatment period na. And then when we say toxicity endpoints, so it would actually help us to determine the specific type of adverse effect of our drug or of our chemical. So when we say toxicity endpoint, it will examine the specific type of adverse effect that a drug or a chemical can produce. So what are these toxicity endpoints that we have? So acute systemic toxicity, again, this is a type of toxicity endpoint if you want to determine the effect of your drug or your chemical when administered only for a short period of time. So that is for acute. And then if you want to know the carcinogenic potential, whether your drug can induce or not cancer, stimulate the growth of cancer cells, you can conduct a carcinogenicity testing, whether through genotoxic, toxic to directly acts on the DNA, genotoxic or non-genotoxic mechanism. So when we say genotoxic, it directly acts on the genes or at the genetic material, the DNA. Dermal penetration, the extent and rate by which a chemical is able to enter the body via the skin. So we also call it as the percutaneous absorption, especially, let's say if your drug will be administered topically. Then ecotoxicity, the effect of the drug or the chemical into the environment. Not only the environment itself, but including the animals and then the plants. And then the endocrine disruptors, so the effect of the drug to the hormones, can it mimic, can it increase or reduce the function of the hormones? Then eye irritation or corrosion, inducing eye damage, let's say by reversible mechanism, causing only irritation, or irreversible, causing corrosion. So I performed this in my graduate school research, itong eye irritation test based from the OECD guidelines. Kasi yung yung dosage form ko kasi is contact lens, a drug-loaded contact lens. So I had to perform this test dahil nga ang target site ng dosage form ko or yung drug delivery system ko ay eyes. So nag-conduct ako, although I modified the procedure kasi matagal to nasa 21 days yata according to OECD. Kaya lang kasi medyo syempre yung budget I have to consider kasi yung mga rabbits ko naka-aircon yan 24/7. Syempre you have to acclimatize first for 7 days, tapos tsaka pa lang ako nag-start ng testing period. So 2 weeks ako lang yung nag-research wala naman akong kasabay. Pero I performed this one. So tinignan ko yung effect ng lenses when they are inserted sa iris, cornea, tsaka conjunctiva ng rabbits. Then of course, with the supervision of the veterinarian, yung OECD kasi ang maganda, meron siyang table. Tapos nandun yung mga specification. So pag nakita mo to sa mata, i-gradean mo siya kung 0, 1, 2, and 3. So syempre, fortunately, puro 0 naman yung grade ko sa effect. Ibig sabihin, wala siyang significant effect doon sa eyes ng rabbit. Wala naman siyang irritation or any corrosion that was observed when I inserted the lenses. And the good thing kasi class, malalaki kasi yung rabbit ko, kaya yung mata nila malalaki din. So parang madali kong nailagay yung mga lenses kahit na syempre yung pinaka-size ng contact lens is not fit for rabbit use. Yan. So yun, na-share ko lang. I perform this one. Then genotoxicity, so chemically induced mutations or alterations to the DNA or to the genetic material itself. We also have the neurotoxicants, their effects on the brain, spinal cord, PNS. So if we have pharmacokinetics for drug, we also have toxicokinetics. So we determine the ADME of these chemicals or drugs. And then phototoxicity, toxic responses from a substance following exposure to light or skin irradiation. Kaya nga 'di ba may mga drugs tayo na let's say yung tetracycline kapag tinake siya nung patient, nagiging sensitive siya sa light or may effect yung light or yung radiation coming from the sunlight kasi they are known phototoxicant. And then repeated dose or organ toxicity from repeated daily exposure of the substance, more on chronic, yung chronic effect ng drug. And then reproductive and developmental. Reproductive class, the effect of the drug or the chemical to the male and female reproductive system. So male and female, kaya usually tinetesto in both male and female, hindi lang sa babae. And then the developmental toxicity from the time the mating happens up to the time the offspring is delivered. So hindi lang yung after delivery, from the mating behavior of the male and female test animal, and then yung development nung baby, development ng offspring until the time the offspring is delivered. So that's those are the things that we note during developmental toxicity. And then skin irritation or corrosion. So when we say irritation, this is reversible. When we say corrosion, this is irreversible skin damage. And then skin sensitization, if the product or the drug can induce a type 4 hypersensitivity reaction, which is contact dermatitis. So kung natatandaan nyo yung example natin dito, si poison ivy. Yan, so this is an example of a design of subacute, subchronic, and chronic toxicity from the OECD. So nandito na yung duration, yun yung kagandahan ng OECD class, nandun na lahat. Yung kung anong test animals yung gagamitin mo, bakit, ilang number of animals, tapos ilang doses yung kailangan mong i-administer, and ano yung purpose, why are we performing such toxicity test. So let me discuss na lang what is NOAEL. What is NOAEL? No observed adverse effect level. And then LOAEL naman is the lowest observed adverse effect level. So ulitin natin ha. NOAEL, no observed adverse effect level. Then LOAEL is lowest observed adverse effect level. Lowest observed adverse effect level. So pag sinabi nating NOAEL, ang keyword natin is maximum. This is the maximum dose where there is no observed adverse effect. Again, NOAEL, our keyword is maximum or the highest dose where there is no observed adverse effect level. How about LOAEL? So LOAEL is the minimum dose or the lowest dose where we observed an adverse effect. So the lowest dose at which there was an observed adverse effect. LOAEL, the lowest dose at which there is an observed adverse effect. And then the design for chronic toxicity is this. And so this is an example of, or these are rather, the OECD guidelines. Usually class, yung OECD section 4, it is, it has 3 numbers or 3 digits, yung kanyang code. Example, kapag ocular toxicity, ito ginamit ko yung 405. OECD guideline 405. Bakit 4 lahat yung simula? Kasi 'di ba section 4 yung health effects. Tapos, nandito na yung 3-digit number na pinaka-code nung pinaka-toxicity testing that you want to perform. Example, kung gusto mo naman ng dermal toxicity, so you can consult 404 tsaka 411. Yeah. It will depend on your needs. And then, for non-animal toxicity test methods, of course, although masasabi natin no na talagang in clinical trials, in preclinical safety testing, they really use animals no for the evaluation. But there are also non-animal toxicity test methods. Bakit? Kasi it's not all the time no na we can use animals. And of course, as much as possible, we want to limit the use of animals. Remember class, although I'm not sure if you were able to experience this, but remember kasi before tayo makagamit ng animals in testing, we have to apply a permit, or we have to get the approval of what? So, saan dapat tayo kumuha ng approval before we can conduct an animal study? So, saan dapat tayo kumuha ng approval bago tayo pwedeng mag-conduct ng animal study? Kasi hindi tayo pwedeng mag-conduct ng animal study kung gusto lang natin. Kasi we have to protect yung animal rights, no? Yung mga animal welfare na yan. So, saan ba dapat tayo kumukuha? Hindi ba ito nabanggit in your research? Are you familiar with AYACOC class? AYACOC? On the chat box or not? Have you heard about AYACOC before? Ayan. So, diyan tayo kumukuha ng approval bago tayo mag-conduct ng animal testing. So, ako noon, nag-process ako ng AYACOC po sa Adamson kasi doon ako magko-conduct ng study ko. Nung undergraduate research naman namin, doon kami sa CEU nag-submit no, ng application for AYACOC approval. So, ano bang ibig sabihin ng AYACOC? Institutional Animal Care and Use Committee. So, AYACOC, Institutional Animal Care and Use Committee. So, hindi tayo pwedeng mag-conduct ng animal test hanggat wala ang approval ng AYACOC. In fact, class, if you happen to see the form ng AYACOC, meron itong portion na tatanungin ka, is there a non-animal model for your study? Kasi as much as possible, ang goal din ng AYACOC is to minimize or limit the use of test animals kasi we have to protect as well their welfare. Pero if not, kung wala, you have to defend bakit ka gagamit ng animals. So, nandiyan na yung pag-incorporate mo ng mga references. So, malapit na po mag-end yung meeting, balik na lang. So, ito yung mga example. Maybe, no, in your study, you are using mga non-animal toxicity test methods. Halimbawa, yung paggamit nyo ng mga bacteria, ng mga cell line. Example yan ng mga in vitro test methods na pwede natin gamitin instead of using animals. And then we have other emerging strategies, no, for animal testing, no, to reduce the use of animals. Antayin ko lang mag-end before I proceed with module, lesson 6.